Everyone. I am Dr. Colonel Sanjay Mishra. I am professor and head of the Department of Army Hospital R&R, Delhi Kent. I'll be speaking on the World Sight Day 2020. What is the importance of vision? As we all know, it is one of the most important sensory organs in the body. Vision is a window to the world. With vision, we connect to others. And with vision, we get the happiness. 80% of our memories are what we see. What is World Sight Day? It's an annual global event which draws attention on blindness and vision impairment. The basic objective of World Sight Day is to create awareness about eye care, vision blindness, and treatments involved in curing the eye impairments. This day focused on drawing attention to leading cause of blindness or visual impairment like cataract, glaucoma, refractive errors, and other diseases. Why World Sight Day? We know that 2.2 billion people have unaddressed vision impairment or blindness. Of this 2.2 billion, 1 billion have a blindness which can be avoided and can be addressed, yet it is not addressed. Approximately 2% of Indian population is blind. 1.1 million people in India are cornea blind. We require more than 1 lakh corneal transplantation, yet we have a dismally low of 25,000 corneal transplantation annually. We know how sight and vision is formed. Vision is basically a signal which is sent from eye to the brain and it is seen in the images form. When we protect our eyes and this vision, which is very, very important unless it is harmed. This is the general anatomy and physiology of eye. We can see that. Some of the common eye problems are, particularly in children and older people, are different as we categorize as per the age. These are refractive errors like astigmatism, myopia, hyperopia, dry eyes, computer vision syndrome, what we call as a digital strain of eyes, allergic conjunctivitis, color blindness, night blindness, and so forth and so on. Common children's problem which we face are amblyopia, which is lazy eye, strabismus, that is squint, ptosis, and in elderly we see presbyopia, cataract, glaucoma, age-related macular degeneration, and diabetic retinopathy. Let me first focus on age-related macular degeneration. Macular degeneration, which is also known as ARMD, is a medical condition where loss of central vision happens. Usually it is common in the fourth decade. People find it very difficult to recognize face, drive, read, or perform other activities which is required in daily life. Visual hallucination can also happen. Typically, it's seen in elderly people, but can also happen in younger people due to other diseases of retina. It is in two forms. One is a dry AMD, where the deposits happen on the center part of the retina, which is known as macula, and it disturbs the normal function of the retina. The other, which is a more dangerous form, is wet AMD, where new blood vessels grow behind the retina, causing it swelling, bleeding, scarring, and a rapid drop in vision. So the risk factors are basically hereditary, smoking, obesity. How do we diagnose AMD? AMD, age-related macular degeneration, can be diagnosed with a form of a scanning of retina, which is known as optical coherence tomography. We see with this, we can see the layers of retina and the area which is affected, along with the fluid or a blood which is collected. Angiography is basically with dye injected into the arm in the vein, and you can see through the fundus photograph and pictures where exactly is the leakage and the problem. Other important cause is diabetic retinopathy. Diabetic retinopathy is a complication of diabetes which affects eye by damaging the blood vessels of the retina. At first, diabetic retinopathy may cause no symptoms or very mild symptoms. Eventually, over a period of time, if the diabetes is not controlled, the retina is eventually affected and damages. The condition can happen in both type of diabetes, which is diabetes type 1 or type 2. The longer duration of diabetes, the lesser chance of getting it affected. One of the symptoms of diabetic retinopathy is that you see spots or dark strings floating in your eyes, which is floaters. It could also happen in normal people. Yet we do find the incidence of floaters high in diabetes. There could be blurred vision, fluctuating vision, impaired color vision, dark or empty areas in your vision. The risk factor, as I mentioned earlier, is duration of diabetes. The longer diabetes you have, the greater the risk. Poor control of diabetes, along with you have high blood pressure or high cholesterol and tobacco usage. Increased use of digital device in COVID-19 situation, it's a very common uh, symptoms in, in this present COVID era. Watching television, news TV, smartphone usage, video on demand, chatting, social media. All these activities have increased tremendously in the daily basis. What is the impact of this on the vision? You feel difficulty in reading, need to clean the eyes regularly, the dust which comes from cleaning the house, shopping for groceries, and working on laptop or desktop. Why there is a need for regular checkups? An eye examination involves a series of tests to evaluate your vision and check for eye diseases. Each test during an eye examination evaluates different aspect of your vision or eye health. An eye exam helps to detect problem at the earliest stage when the treatment is most effective. Regular eye checkup helps early detection of disease and to treat them in a better manner. Various eye tests could be done by testing the vision, the refraction, visual field, a slit lamp examination, which is examination of the machine, a retina examination, and screening for glaucoma. Children between 3 to 5 years should undergo comprehensive eye test. And if there are no symptoms or family history of eye diseases, once every 2 years is good. We should also pledge to donate our eyes and light up somebody's life. There is a website you can go and check for visually impaired for your eye donations. Thank you so much. Hmm? हो गया